Everyone. Welcome to the much awaited program of the one of the flagship programs of Indian Society of Critical Care Medicine, Hyderabad chapter. I am Dr. Dr Swarna Deepak, Secretary of the Hyderabad chapter. So this is a very prestigious program and one of the most awaited programs from the students, the Meet the Master series, where we'll be interacting with the masters in the particular fields of each of the critical care and on a general medicine on a note. Today, the topic is very interesting and it is very much relevant to both the students as well as the consultants in multiple departments of the medicine. So we all know what is the importance of research, but we are all clueless about how to do the research, and especially how to do the research, how to plan it in our student period or in your training period. It may be an MD, it may be a DM, DR, and BR, whatever it may be. So we need some guidance. In fact, I myself have found lacking at many times. Whom do I need to go for? We need someone to actually shepherd us to do how to plan the research, how to do it, what are the steps where we need to improvise, how to publish ultimately, and how to make a difference in the patient's life at the end of the day. So none other than Dr. Amar will be taking through is Dr. Amar Havaldar is our speaker today. Madam is the Associate Professor, Department of Critical Care Medicine from St. John's Medical College. She has multiple achievements to her credit. She has done her MD, DNB, DM, FNB, EDIC, as well as the degree in medical law, as well as fellowship in neuroanesthesia. She is the awardee for Hansraj Nair Award in 2016 for the best research. She is examiner for various phases of the students like DM, IFCCM, IDCCM, and FNB. She has published in very good high impact journals. In fact, I've gone through many of them and inspired by them. And she's presently doing a pioneering research in multiple multi-center studies as well. Her areas of interest are particular in weaning, echocardiography, ARDS, and endothelial dysfunction. So looking forward to listen from Madam. And Madam will be going through her presentation. At the end of the presentation, we'll be taking questions from various delegates. Over to you, Madam.
Thank you, Dr. Deepak and ISCCM Hyderabad chapter for giving me this opportunity. So today I'll be talking upon how to do a quality research during critical care training. And I have divided my talk into various aspects, like why research is important, how to get a good research idea, and what are necessary approvals we should have before starting our research, what case record form should be comprising of, how we should collect data, how we should analyze, and writing of the manuscript, and ultimately publication of the research. So I have shown you one diagram here, why research is important. So as a clinician, you can think that how I am allotting my time. So this will be the ideal situation, like you have allocated adequate time for three major aspects like clinical work, teaching, and research. But it may not be the case in real life. So what actually happens in real life is nothing but majority of the time is taken by your clinical work and teaching, and there is hardly any time for doing research. So you may ask me that why I should do research, how it is going to affect me. So the important thing to remember is, the question over here is how your clinical practice had changed over last 10 years. So the answer lies in research which was published during those 10 years. And that's how it is important. So it is definitely influencing your clinical practice. And what you have learned so far is more and more interventions are not going to be useful, like especially giving fluids. So we have gone to restricting the fluids in our patients, as well as activated protein C. We realize that it is not going to be helpful. So indirectly, we have taken into account cost minimization. So these are the all outputs of research. Similarly, tidal volume, which has helped us in managing our patients effectively when they have ARDS. So if you look at the definition of research per se, what it says, it's nothing but it is a systematic investigation or an inquiry what we are going to do in order to know new facts, and we are moving from known to unknown. So that is a major reason why we are doing research. If you look at the term per se, what it says, research is we are repeating the search to address the limitations of already published studies or available evidence. So these are the main things you should focus on choosing your research topic. So whether already facts are known about that topic and how my research is going to help. When we look at during training period, why we should do research? Probably you will think that it is a mandatory requirement for appearing for the exam. And if we follow this rule, what can happen? So it can definitely affect the quality, because as a completion, you are going to do research and you will choose the topic which will not be having any relevance in clinical practice. Majority of the times topic can be selected by guide and students have no interest in that topic. So that again is a problem. And you are doing research under time pressure that before appearing for exam, I have to complete it. So, and likely that you will duplicate already published studies. So stay away from all these problems. And if you yourself are interested in doing research, it will become voluntary and you will allocate enough time for doing research. And when you select topic of your interest, definitely you will look into it and carefully you collect data and you will focus on how I can analyze and publish my research. So these are the things you should keep it in mind. The important aspect is how one can get research ideas. The question you have to answer here is need or justification for the study. Why I should do research on this particular topic. And there are several questions you should ask, like what is not known about this topic? What are the knowledge gaps? Is it an relevant and important question when I am managing patients? Is there solution required? And I'm struggling to manage patients in real life. So definitely I want to find some answer which can help us in managing our patients. When I look at the available evidence, there is no available evidence. Or other case, it could be that there are various studies which has shown, few studies would have shown the particular therapy or intervention is helpful, and subsequent studies would have shown it's of no use. So you are confused that is it going to help us in managing patients? Should I use this or should I not? So these are the certain areas you should focus on. When you are writing your synopsis or research proposal, you have to ask these questions: how my research is going to help? If I do the research, what are the possible results? And how it will change my practice? How it will help patients, healthcare workers, or broader aspect like how it will help the society. Okay. Then you will ask me, you have told us these are the aspects we should focus on. From where I'll get the idea to do a research. So idea will come from your patients. When your day-to-day practice, when you're seeing your patients, you will realize that there are some things you are doing which are not really helping the patient. So you have to have careful observation. Please ask questions like ask for justification why I am doing this, like administration of certain drug or administration of particular IV fluid. And be curious and don't just accept the available evidence as it is, because each study will have its limitations. Then define your PICO question. So this is most important. In which population you are going to do research? Whether you are going to do some intervention or it is only an observational study. Then you are going to analyze and what is your outcome. So focus on primary outcome of your study. Why it is important? Because your sample size calculation depends upon your primary outcome. So you would have selected very good topic, but ask these questions to yourself. Is it feasible? Whether the topic is interesting, whether it is novel, whether it is ethical and relevant. So you may not have all ticks here, but mainly focus on, is it feasible to do? Suppose I design a very interesting question, and then when I started doing the research, what I realize is the particular population I'm going to study, these patients are very less in the ICU. So probably in a month, I'm seeing only 1 or 2 cases. So if that is the case, is it possible to complete this study during my training period? So choose your topic properly. But I'm not telling that don't choose a topic which is very simple and which is already done. When sample size only is the problem, what you can do is include multiple centers. So multi-center study is also possible, which can help you to achieve the target sample size. Okay. Now the next thing is how to know if idea is novel or interesting or useful. Please do literature search in PubMed. So the moment you put your research question, see how many articles are coming. If it is already more than 1,000, 2,000, then probably it is well studied topic, and even if you do study on that topic, it will not add additional value to the existing evidence. So as against if you put a research question and you find that there are very few studies, like probably less than 100 or 50. So probably this is the research topic you have to focus on, because there is no enough information available regarding this. Next thing is discuss your project. So please present your project in the department, discuss with the faculty or colleagues, and see what are the difficulties you are going to face when you actually start doing research. That can help you to design your study properly. I'm not discouraging that if it is not accepted in the department. So there are probably some reasons that your colleagues or faculties would have pointed out that probably it is very difficult to do and unlikely to complete during training period. So try to find out ways by which you can modify your methodology by which you can complete your project. Please write down the methodology. When you write it down, you will know what are the problems you are going to face and how I can select the study design, which study design is appropriate for my research. I have shown you the pyramid of evidence, where you can see at the top, it is comprised of systematic review and meta-analysis, or very well conducted high quality randomized control trial. And this is followed by cohort studies, case control studies, cross-sectional studies. I am not going to tell you what is the difference between each study, but I would like to focus on these questions. First scenario, if I find any interesting finding in a patient, probably I can write as a case report. If this finding is getting repeated, probably 10, 20 patients, I can write it as a case series. When I'm looking at an intervention to compare this intervention to the existing practice, the trial design ideal should be randomized control trial. When I want to study the effect of certain factors on the development of disease, this particular is your cohort study, where you are observing the patients who are having risk factors till they develop disease. The next thing is, if I want to compare the risk factors in patients who have disease and the patients who are not having disease, probably I'm dealing with case control study. So these are broad criteria which can help you to decide your trial design or methodology of your research. Okay. So other scenario is, if at a given point of time, I want to know how many patients are having VAB, how many patients are having DVT. So probably I'm talking about cross-sectional study, which can tell me about point prevalence. There is another aspect of research, that is a qualitative research, where you are collecting data which is not in the form of numbers, but it could be in the word format. So in this particular scenario, if I want to know patient satisfaction, probably I can design questionnaire and probably conduct survey, which can help me in knowing are there any difficulties or problems in the process of care. If I want to study the burnout among healthcare workers, again, survey could be a good design for doing this type of research. And when I search in PubMed, I saw that there are various articles with mixed results. So probably I have to do systematic review to critically review all the published studies. It could be randomized trials or observational studies, and try to do meta-analysis, which can give me statistical summary of available evidence. And then I can know whether the intervention is going to help or not. Then coming to sample size, how I calculate sample size. Please discuss with the statistician during early stage. The statistician should be involved in early stage, not after data collection, because it can help you in calculating sample size correctly, as well as whether you can decrease the sample size based on some manipulation like or checking margin of error or standard deviation. So these are the possible things which you can discuss with the statistician. Multi-center study, I have already told you that this can help you in achieving target sample size in a shorter time. Even during training period, you found that the sample size for my study is 200. And if you include 5 to 6 centers, your workload will come down. But you have to supervise that proper data collection is happening. You have to assign roles and responsibilities to the each center's principal investigator. And timely, you have to evaluate that. Probably every month you can assess how much sample size you have achieved. And please have please have agreement or MOU sign, and you should have clear-cut criteria for authorship as well. Okay. Then coming to ethical committee approval, you cannot do any research without getting approval from ethical committee. And in any prospective study, you should take consent from the legally acceptable representative. There are certain things you may be seeing that it is a standard of care, like doing some intervention or doing certain tests. It is routinely practiced in the ICU. So probably you can ask for waiver of consent in those situations. CTRI registration is made mandatory by few journals. So better you should, after getting IC approval, please apply for CTRI. And you need IC approval for that. So unless and until you have IC approval, you cannot register in CTR. There are certain guidelines for giving authorship. So this also you should know who qualifies for authorship. So these are the certain criteria, and each one is it's not only collecting data or drafting the work or reviewing it critically or final approval of the version to be published. So it is all, each phases you need equal contribution from the people who are involved. So if you delegate the task, you can complete it in shorter time. So you need team basically to complete your research. So there are other types of authorship. So please stay away from these authorships. Like person who has not contributed should not be given credit. And person who has contributed enough and who qualifies for authorship, he should be given authorship. The next question is how I'm going to collect data. There are various softwares which are available for data collection. Excel is the easiest and easiest software which is available for free. So you can use Excel because ultimately when you collect data in red caps or any app, you have to convert it into Excel file. So you think about it, which software is easily available? Is there any cost involved in choosing the software? So keep those things in mind. Google Forms also could be a useful thing, especially when you are collecting data at one point of time, like point prevalence, or especially if you are doing survey, Google Forms is the easiest tool which is available. Then data validity. So how you know that data collected is valid? So especially when you're including more number of centers, each center will have different way of collecting data. For example, temperature. So you would design your case record form in such a way that unit of measurement is also mentioned. Otherwise, this will take a lot of time for data cleaning. So you can regularly check how each center is entering and what is the unit of measurement, especially for temperature, platelet count, or creatinine or calcium. Data cleaning is also equally important. If you are seeing extreme values, please cross-check whether really these values are correct. If you have patient details available, definitely you have to cross-check. And don't remove the available data just because it is extreme. It is not correct. Whatever data you have collected, you have to analyze. But make sure, because it is a manual entering of data and it can lead to different errors, like entering in the wrong column, for example. So please check all these things when you are doing data cleaning. Then there is another problem, that missing data. So as far as possible, try to collect data completely. For example, there are 10 variables and you have missing data for 10 patients. The sample size is 100. So probably around 10% missing data is acceptable. But missing at random means the variable is missing for few patients. And so in that case, what happens when you do statistical analysis, total number of patients available will be very less, because even though you have collected Apache for 100 patients, but actual data available is for 80, directly you're losing data of 20 patients because you don't have any values. So try to collect properly all the variables, try to improve the completeness of data collection. Coming to how I can analyze data. So there are various softwares which are available, like SPSS, Data, or R software. Out of these, R software is freely available. SPSS probably you would have already used or studied. Stata is also available, so you can choose which software you are comfortable. Learning one software will be easy. So probably in today's world, I would recommend R software will be better because it is upgraded and it has newer analytic techniques also. So you have collected data, you have analyzed, statistical analysis is done, and you are in a phase of writing a manuscript. So there are different aspects how you write a manuscript. So even though I have shown this is a sequence, the first thing you write in a paper is methodology. So before even starting data collection, your methodology part is already ready because you would have submitted to IEC. And subsequently, you would have done literature search and your references would have been already collected. The next step is collect results and then do statistical analysis. During the study period, look at whether there is any change in the available evidence, whether new studies have already come. And please include recent references. Probably last 5 years should be acceptable. If reference is very important, then probably you can include previous references, but stick to recent references. So usually journals will tell you that please include recent studies of last 5 years. Then coming to discussion. So discussion aspect is you are comparing your results with the existing literature, how your study is different. For example, if in your study, the age group, what was the age group? Whether it was younger patients or older patients. Is there any similar study which looked at these aspects? So please quote these references. Then coming to comorbidities, was there any difference that particular patients of hypertension or diabetes has more mortality? So please look at the evidence which supports your findings, and as well as find the evidence which is against your findings. So you are giving overall analysis or detailed evaluation of your study while comparing with the existing evidence. Please mention your strength and limitations of your study in discussion part, and then last comes your conclusion. So after methodology, results, and discussion, probably then you can write your introduction, because the references you would have used during discussion, you can include important references in introduction as well. Then tables and figures, only relevant tables you should include. Don't duplicate the results in tables as well as in manuscript. Minimize the information, and probably you can reference that this information is given in table 1 or 2, like that. Then conclusion, and the last thing you write is your abstract. Okay, so this abstract is summary of your research, and when you submit for a journal, the first thing editor will look at is abstract, title as well as abstract. So make sure that you incorporate important findings so that it will give, means help in knowing what particular study is about. And if it is interesting, then probably people will read about what are the methods, how the study is conducted. Can I do this study in my setting? So your methodology should be very, very clear. So if somebody wants to do similar study, he should know that how you have conducted study. Was there any problem in the methodology? Was there any limitation? So please write all this, and references based on the journal recommendations. So please focus on all these aspects. And coming to last part is publication, how you publish. So please find proper journal. There is a list of predatory journal, or when you are searching for a journal, you will not know. Is it a right journal? Is it a predatory journal? So look at all these aspects. Check for indexing, whether this journal is regularly publishing, who are there in editorial board, what is the impact factor of this journal. And when you are choosing the journal, look at the aims and scope of the journal. Is it same as your research topic? So accordingly, you choose the journal. Look at the author guidelines before submitting, because the technical check, initially it will go through and then it will go for peer review. So if you have followed author guidelines properly, directly it can go for peer review process. So you will minimize time. And on an average, journals will take 2 to 3 months for after review process. Then only you will know that whether your journal is accepted or it needs certain revisions. Some journals are taking long time, so please choose your journal, because if you submit in a journal and it takes almost 6 months, so what happens is the information which will come as a publication will be very, very late, and it would have lost its importance. So please choose journal wisely. If I tell you to do to attend certain research methodology workshop, I'm not recommending any particular workshop. So one workshop may help you to know how to conduct research, but unless and until you do research, because after doing research only you will realize what are the difficulties, how to overcome this, how to solve problems. So better do research and learn as you find any difficulties. Discuss with your mentor or guide, discuss with your colleagues. So form a team that is going to help you in completing your project timely. So in the end, I would like to tell research is a continuous process and not limited to just data collection or publication. During the journey, you will learn various aspects of doing clinical research. So enjoy the journey. Key aspect in research is research idea. So if your idea is good, likely that people are going to read your article. After idea, next comes is methodology. If your methodology is sound and there is a biological plausibility, and then IEC approval, everything you have taken, probably you are this journal, this article will get published. So you have to understand that we should challenge the existing knowledge. So that's how the progress happens. And research is the only tool which can help us in changing the existing knowledge. Thank you.
Thank you, ma'am. As always, simple but very clear lecture from you. So I think many of the students, I think they have so many doubts which they were embraced to ask in the regular, maybe their teachers or colleagues, they want to ask you. If you're okay, we'll start with the questions from them, ma'am. First question was, you're muted, ma'am. Yeah. First question was the one of the students asked was, what are the common mistakes you observed students doing in the training period when they're planning thesis and subsequently in the period?
Okay, so common thing is the research topic is not selected properly. So the choosing the topic which is already studied and many articles are available. So if you are duplicating the study, which will not add to the evidence. So try to choose a topic carefully. That is the most important thing I would tell students. You may take 2 to 3 months to choose your topic, because if your topic is good, likely that after doing the study, this will get published. If your topic is not relevant, then the publication will get affected, because you will realize that publication is not an easy task. Okay, we have to choose journal and it's going to take a lot of time. And after putting so much efforts, you are not sharing your research with people, it's of no use. So please focus on selecting a topic carefully.
Yeah, ma'am. Second question was more of a continuing of it. What was your experience when you were a student? How did you choose your topic? How did you go ahead?
Okay.
Could you impart?
Yes, so during training period, while choosing the topic, so it's not like in one go I got a topic. So probably I would have gone through minimum 3 to 4 topics. So after discussing with my mentor as well as my colleagues, what I realized is out of 4, 3 topics, although they were good, but it was difficult to do study during training period, because there are prerequisites. Before appearing for exam, you have to finish your thesis. Okay, so choose your topic accordingly. So I had gone through minimum 3 to 4 topics, and myself, I realized that these 3 topics are not possible to do because the time is short. Any research you want to complete, from IEC approval to data collection to analysis, minimum time required is 1 to 1.5 years. It's not easy. So if 1 year itself is gone during data collection, so and based on the sample size, so you have to see whether these based on the study topic, whether I'm seeing these patients regularly. Suppose I select a topic and I'm seeing only 1 or 2 patients in a month. Unlikely I'm going to complete this project. Okay, other solution for that is it possible to collaborate or do multi-center? So that is one thing we have to discuss. During training period, it is possible, but you have to have a good team and coordination from other centers, so that you know that you are likely to complete this project in particular time frame. So that's what I can say.
So about your practical experiencing, I think you got the Hansraj Nair award. So what was your experience, ma'am, in getting to that level, the proper one?
Yeah, so the study which I did was on cardiac dysfunction induced during weaning process. And initially, it was little difficult to recruit patients. Like each time when extubation is planned, I have to do echocardiography. So sometimes it's not feasible. Although initially we planned that it has to be a consecutive sample collection. Unless you have 3, 4 people who are going to do echocardiography, it's not going to happen. So this was one limitation we realized. But subsequently, we could do almost 120 patients, and post extubation also we have repeated echocardiography. So it was pre and post extubation, and we compared that what are the echocardiographic parameters which were predicting weaning failure. Okay, so we looked at E by E prime, and what we found is E by E prime at the time of extubation was not different in patients who failed or successfully weaned. And post extubation, what we observed, when the PEEP effect has gone and patients were extubated, when the intrathoracic pressure became negative, these patients land up in pulmonary edema leading to weaning failure. So that was the observation. What I felt is the methodology was correct, and data collection analysis we could do properly. So probably that would have helped me in presenting my study.
Okay. So other one was, I don't know the statistics, how to do it. I always find it very difficult.
Okay. Yeah, that is important question. So nowadays, actually, BCBR has designed one course, and it has made mandatory for at least postgraduates as well as DM students. So this is one course you can go through. There are 23 modules which discusses about each aspect of research and statistical analysis. I don't expect that you should do statistical analysis on your own, because if you focus on that, see, you can take help of statistician. Better to focus on research, idea, and methodology. If your idea and methodology is good enough, doesn't matter the results are positive or negative, it will get published. So take help of statistician during early stage and calculate the sample size, and then after do analysis. If you yourself want to do all the things, it will become difficult. But if you want to learn, I can tell that our software you can learn. That is one thing. But focus on important aspects. It's not like you are going to know the person who has done BSc or MSc in statistics. It's not going to happen.
Yeah.
Probably just know that what are the important tests I'm going to use in day-to-day practice. Probably how I present my data, whether mean, median, or any other form. Which test I should use when the data is uniform or normally distributed. Which test I should use when it is not normal. Chi-square, when to use when the data is categorical. So there are 3-4 important tests only we are doing when we analyze. If you go through the journal articles, you will get an idea that these are the important things. It's not like advanced statistics you are going to do.
Yeah.
And you will be able to learn these important 3-4 statistical analysis. So it should be okay.
I think, yeah, that is the most popular question, ma'am. The people are afraid of statistics.
Yes.
So another, I think, couple of questions more. One question was about the writing of the paper, ma'am. Once the data collection was done, so what is the approach to writing the paper results discussion part? How do you do it?
Okay, so discussion is the important aspect, because when the reviewer goes through your paper, he will see that how you have presented your results and how you have compared with the existing literature. So when you do that, you can divide discussion into different parts. Like initial part, you can just tell that what study was about and what you found. Subsequently, you try to focus on each variables or parameters, like what was the demographic characteristics of the population studied, how it is different from the available literature. Then coming to the comorbidities, was there any difference in comorbidities? Then coming to the severity of illness, like Apache or SOFA score, if any of these things are collected. Then coming to the particular results of the study, whether the observations are similar to the previous studies or it is different. And if it is different, you have to give reason. What are the possible reasons you are thinking that you found different results from the available studies? And after that, don't include too many studies. Try to focus on important studies. If you include 10 to 12 studies, the focus will be, means it's difficult for reviewer to focus on important aspects. So choose the studies wisely. And after discussing this, you write what are the strengths of your study. Okay. So mention strengths as well as limitations. Each study will have certain limitations. So state it. If you state it, probably reviewer will understand that these are the aspects this study is not focusing on. Why it will help? Because somebody is planning future study based on your results. They will take into account these limitations and plan their study accordingly and write down the conclusion. That is a key aspect, that what you found, how it will help you in managing patients, and future directives, like how it is going to help, and future research should focus on what aspects. So that should be the part of discussion.
Yeah. Last question for us, ma'am. What do they say? They have, I think the question was, ma'am, I basically study in a institute where not much of a research happens. So is there how to, like the question was basically, is there a source or maybe hand holding persons to actually guide them where there is not much of a research going on in the institute? It's a very common thing which can happen.
Yeah. So unless you start it, you will not learn. So once you yourself start doing, you will realize that these are the aspects I have to focus on. Probably you can collaborate with the centers which are having existing research or ongoing research. So that should be the initial step, like involving in multi-center projects. So in that you will learn that how one should collect data, how to recruit patients. So this could be initial aspects. If you are totally unaware how to do research, then probably you can start with case reports, like any particular interesting finding you have seen in a patient. Please report it. So it is very easy. During training period, definitely you can write case reports or case series, like observational studies. So what you need is ethical committee approval. If your institution doesn't have, so probably you have to see the nearby hospital which has ethical committee, and probably you have to get IC approval, and then you can start doing research.
Yeah. Do you have any sources where books or maybe somewhere or maybe channels somewhere they can actually handhold the students, man?
Yeah, so the sources, see, with what I can tell you, with AI, there are various research tools which are available. So one of that is Elicit. I can share the details. So SciScape is one tool. So these are the tools which will give you summary of the available literature. So they are summarizing the article in probably 3-4 lines. Because when you do literature search, you will realize there are hundreds of articles. How you are going to read those many articles? So this is one of the tool I found. But the type of study it will select, it's not depending upon the clinical importance. So unless you see that, is it important study which the tool is showing, it will not be of much help. I can tell that please go through the more and more you read, like available literature, like recent journal which study has come, like intensive care or any article, any high impact journals. That will help you that what is already ongoing research, and accordingly you can plan for your research.
Thank you, ma'am. I think we reached the time limit.
Okay.
Thank you so much for your time first. Very crisp, lucid, and I think very clear lecture. Look forward to listen to you. And if there are any, I think there are multiple questions. If there are any, I think we'll reach you on the mail and we'll send.
Yes.
And with any further research guidance, please let us.
Yeah, definitely. Thank you for the opportunity. Thank you.
Good day, ma'am. Thank you, Pranalitha. Yeah. We can log.